ready.
Okay, so next I wanted to discuss nursing values and which ones you feel are most important to your position as a case manager and the care you give to your patients.
So I think first and foremost, you have to have integrity. I think you need a level of integrity with patients because that's what's going to drive your care. In addition to integrity, I think that you should have compassion. I think that's a great big thing. And I think also that when it comes to nursing, we can't have biases. So we have to have that field of justice that everybody is created and everybody deserves care. I don't care about what your sexual whatever is. I don't care about what whatever you feel that's best for you and whatever you recognize yourself as and identify yourself as. Then as a nurse, that's what we have to do.
Right.
It's all about care because I don't want to do something that will impede the patient's care because I've said something and done something in a certain way. The patient clams up and cannot express themselves. So I don't want to ever be that type of nurse.
Great, that's a great point of view. What are some of the levels of care that are implemented in case management? So do you more so deal with the individual or the family or the community? Like how does case management interact with the level of care as a whole?
So with case management as well as with my current role, you deal with the patient, but you're bringing in resources, whatever it takes to get that patient to the next level in care with the optimal outcome. So you deal kind of with a little bit of everything because sometimes someone may need a resource for psychosocial help. Someone may need a resource for their kids. So you can't take care of the patient if you don't address the whole issue, and you have to look at the whole issue and address the patient in totality, and that includes just bringing everything into play with the patient, whatever it takes. I can't deal with the patient, and I know that I can't take care of a patient and that patient's worried about whether the kids can eat or not, or this, that, and so whatever resources that I have available, whatever I have, I try to give that to the patients and kind of direct them with care.
Okay. So types of technology or informatics needed to perform the role. I know you spoke a little bit about Allscripts. What type of programs do you use for the case management?
So informatics, that's what drives the boat when it comes to care because everything is electronic. So you have to have some knowledge with informatics and how that works in the documentation process with patient care. There's certain programs, certain hospitals have certain programs. There's Sunrise. There is the new there's the LA program, which is a new one that my company is going with, Orlando Health is going with. Actually, they'll start rolling it out and they'll roll it out in sessions. So not the whole hospital won't flip over at one time. Each department's roll out in sessions. There's Allscripts that's used for documentation and some things as well. Then there is Varian or ARIA when it comes to the radiation side of it. All of their treatment or whatever they do for patients is documented in that system. So it's different systems, and sometimes the systems overlap and talk to each other. So you got to have the information correct in your primary system so that when it feeds over to the secondary system, everything is correct.
Okay. Health promotions and interventions that are most often used. So how do you help your patient reach optimal health in your role?
So how would I do that in my role? So we're going to use an example of a patient that's had a recent surgery that's been in the bed. So first of all, I need to optimize that patient by getting that patient into some activity. So then I'm going to suggest to the primary nurse or to the doctor, can we get a PT evaluation and just come and see what that patient can do? Then upon the PT evaluation, that will drive the boat as to what I will offer for the patient when it's time to discharge the patient. Whether it be in-home PT or be outpatient-based PT in a facility that's outside of the home. So it just depends on what we see, what you're dealing with there.
The next question I have for you, levels of diversity and multiculturalism, and I really thought this was a great question for you because cancer doesn't care about your race or your religion or anything. So tell me how you deal with the diversity and multicultural experiences that you've had in the position and how you take care of them no matter what their cultural background is.
So with that question, it's understanding the patient's culture, and honestly speaking, I have had to go back and look at a patient's culture, kind of read up on something about this culture, just so that I'm prepared when I know how to go in there and address a patient.
Absolutely.
When it comes to typically what we always know is the Jehovah's Witnesses. We know that they do not accept blood products. That's just a bloodless transfusion. So I had to go back and study up on that, so I'm equipped when I handle that, when I come across a patient like that. And I understand their preferences. That's their preference. That's their religious preference. That's part of what makes them them. When it comes to other preferences and cultures, you look at certain cultures where the man is head of household, and you got the woman and you got the man in the hospital bed, but the man is head of household with certain cultures, so you have to take that into consideration as well. And I have to listen to him, and he may say something to his wife, but I understand that it's not personal. That's their culture. Their culture. Wife is not upset about it. To me, I would think, well, that sounds a little bit brash or harsh, but wife is not upset about it because that's their culture, and she's accustomed to that. That's how they do. That's what they do. And some cultures where the firstborns, the sons, rule everything, make the decisions, and there are no girls. The girls don't make the decision, kind of like on anything. So you understand that too. You see patients as patients, and you respect the different cultures, whether it be Hispanic, be Haitian Creole, whatever it is, Caribbean, whatever the culture is. You just respect each person's culture.